Aylin, say hi. Say hi to Miss Alicia.
Hi. So I'm Alicia. I'm the nurse practitioner. I'm going to see you today with Dr. Gabos. Okay? Does that sound good? And this is my friend
You really looking.
She's hanging out. Hi. Yeah. So your mom was just saying that you're doing okay, but she thinks you're getting more tight. Is that true? Is it mostly arms
Yep,
or legs
arms.
or both?
Arms.
Especially? Okay.
Yep.
Is it harder to get him dressed?
Yes.
Okay.
And we did the Botox
I was
in
going to say that was back in May.
last year.
Okay.
And I was thinking about giving it another try
Okay.
because I don't know if it just was the time.
Yeah.
I don't.
Well, we'll talk with Dr. McManus about it and see if she thinks that that's a good idea. We also have an upper extremity surgeon here that if we think that a surgery would be better for him. For his
Surgery?
arms, I'm not saying that it is, but she's the expert in the arm surgeries if we ever were to think that that would be helpful for him.
Okay.
Okay. Her name is Dr. Ty. She's great. Legs, do you think that they're getting tighter?
No.
No? Okay. Do you think anything's painful for him?
No, I don't think he's in any pain.
Okay, okay. Any more trouble sitting up than he was before? Just
Same.
Is that scoliosis? Okay.
Yeah.
Still using that.
They told me that he didn't have scoliosis.
So last time, hold on.
Because I brought him here for an emergency appointment because one of his therapists said that his back, get him checked out. And Dr. Gabos said he was fine.
So he showed, here's what it was. So we said last time that he showed some signs that he might have it, but it was totally postural last time, meaning he only had it based off of how he was sitting.
Oh, okay. All right.
So that's just called the postural scoliosis.
Okay.
He could develop one in the future, but last time you're right, it was completely postural and we could completely get rid of it with position changes.
Okay.
But you haven't noticed that like he always wants to lean to one side. You do.
Yep.
What side does he lean towards?
Towards the right.
Okay. Sometimes that can be a sign that there's a more of a structural scoliosis developing.
Or just to the front like this, like he was just doing.
Yeah.
So.
Okay. Gets all of his therapies in school, PT, OT, speech. Yep. Okay. Anything out of school at this point?
Yes. He goes to therapy.
Okay.
He's getting PT.
Okay. Once a week?
Yep.
Okay.
Sometimes twice a week.
Great. Okay.
Depending on how the schedule is.
Awesome. Good for you. A lot of work. And then you just, right? And you feel how he resists. And so that's the angle that you're measuring. So he's just past neutral. So that's neutral. Gotcha. So I'd say that's about 10. Okay. See his elbows ever? Like about this straight, or do you get him more than that?
More than that.
Okay. Again, so being cold first thing in the morning, and we're making him sit on crunchy paper. Oh yeah, there you go. So you have to overcome their natural tone. So you don't push against it because you can break something. Nice and gentle. Yep, exactly. So look at that. Let me see if your gun's like. Oh, there he goes. Okay. Yeah, I'm going to say that's about 5. So 5 to 120. That sounds pretty good. Let's check these hands. So you can do this and then open his hands up, but watch when I do this. It's tighter. Because they all fit. They all go together. So actually, I can get his hands. So he's tight, but not like, oh my gosh, I can't open it.
Yeah, he's pretty good with his hands.
Yeah. Okay, that's good. I mean, we have kids who are like this. In worst case scenario, so I mean, ideally you want their hands open so that they can use them, but some kids just don't use their hands. So then the next thing is they need to be loose enough or in a good enough position they can get them dressed. I mean, you saw how long it took us to get a sweatshirt off, right?
That's how it is with the jacket too. But that's my biggest fear: his arms and his hands getting stuck like that.
Yep.
So if I'm trying to do anything to prevent that, I do not. I really don't want to get his hands stuck like that.
So far, I mean, the night I'm going to come over there and do it, and then I'm going to move this in. So far, I mean, it's just his tone that I'm seeing.
Right.
It was a little bit. I mean, I can't get his fingers perfectly straight. So using those nighttime hand and wrist stretching braces are probably the best thing for that. For his hands. Now, some kids don't tolerate them very well. Like, does he sleep in them okay?
Yeah, he's fine.
Okay.
Yeah.
So just making sure that, you know, if he's ever getting tight, you use him every night.
Okay. I never really had too many problems with his hands.
Okay. That's great.
I just don't want him to get
Don't
stuck
want them
like
to get
that.
Yeah.
Because I see a lot of kids.
Yes, exactly.
He may.
So see, look how great this. So I can get him. Yeah. And same thing. You just want to just let him stretch, because if your elbow never goes all the way out, your body makes this elbow joint get tight. So then eventually it can't go all the way out. So those the ones that he wears at night?
Yes.
So those ones are more for your thumb. Yeah. Oh, actually, no. Yeah, they don't actually go all the way out to his fingertips.
I left one home.
Oh, no, that's fine. So does he have ones that go all the way out to his fingertips? That's probably what he's going to end up needing.
Okay, that's fine.
Yep.
And will you check the back brace too today?
Absolutely. Yep. So we'll put him in that right at the very end.
Okay.
And you said he leans more towards the right? Or
Yep.
the left? Okay.
He's tighter on the left though.
Okay. Yeah, he is. He's just a little bit. Okay. But look at that. But see, so see how his wrist is flexed just a little bit?
Yeah.
And I can get him all the way. But then when I come up, that's what started to get tighter. So the brace that we'll give you stretches this and this at the same time.
Okay. Oh,
so
good.
that's why they're better. So the ones that he has now are just stretching his wrist, but then his hands can curl up on top of it. His fingers can. The one that we'll give you will stretch everything. Okay?
Okay. Yeah.
All right, sir. Let's take a look at this back. So what we're going to do is actually just sit him up. Yeah, you're okay, I promise. That. You just kind of keep him there. Good. And I'm just going to check his back. He's actually leaning right now a little more towards the left.
To the left.
Yeah, but no, his back actually looks pretty good. Let's not develop a scoliosis, please. Okay? Dr. Gabos is very good at treating it, but if he doesn't need to treat it, it's best not to. Okay? All right. Have you lay down, and then I'll go grab Dr. Gabos. And
Okay.
We'll come in, okay?
Okay.
All right.
How are you, handsome? You doing good? He's been pretty well since we last saw him.
Yep.
Just having a lot of seizures.
Not a lot. He's having this new type of seizure, and I talked with Dr. Alicia. She wants to do an EEG on it to capture it on the screen. But other than that, he's fine.
Okay.
He has about probably like 5 of them, 3 to 5 of them a day.
Okay.
Do you think he's getting tighter in his legs at all?
I feel like his legs is about the same. I just feel like his arms are getting tighter. Hey, say hi.
So, Mom, I'm just going to check his abduction of his hips here.
Okay.
Because his hips starting to come out again on this right side.
Oh, really?
Yeah. So I was wondering if he was getting a lot tighter. Let's check him first here.
So that means he's going to have to get the surgery again.
It's possible. So that was about 3 years ago that we did that.
Right. He hit me 5 in March.
Yeah,
I think we did it. Wait, did we do it when he was 3 or 2?
2.
2?
It's just under 3 years, so it was 2014. So we're in 2017 now. So,
Oh, okay.
so it was almost 3 years ago. So his abduction on this side is maybe 30 at best.
Okay. Yeah, I got 35, so.
So what happens, Mom, we lengthen these muscles, but they end up reconnecting and reforming, which is fine because then they start working again, but sometimes they get tight again.
So what can I do to prevent it? You think hippo therapy would be great for
It's
that?
really just stretching.
Okay.
On this side, it goes to about 50.
50?
Yeah.
Okay.
But Mom, I can feel a pretty solid muscle in there, and I know I released that muscle because I did it myself,
Right.
and it's already it's sort of reformed.
So it would just be on one side if he had to get it
We
in?
usually do both sides just to
Okay.
keep them symmetric. I'm a little surprised that he's gotten tight again because we also.
All right, buddy.
He might go up.
Okay. Breathe good?
Mm-hmm.
also knocked out the nerve to those muscles to help keep him from getting tight again, and yet he still did. So
Okay.
some kids are weak.
So the sooner the better.
And so, what I'd like to avoid in him, which may or may not be avoidable, is the bony surgery that we do to get these hips to drop back into the joints. That's a pretty big operation
I
in the
remember you
grand scheme
telling
of
me
things,
about
right?
this.
So we have to cut the femur and drop the ball back into the socket, and then make a cut above the socket. If they're over age 8, which he's not close to, we're only halfway there. If they're over age 8, just lengthening the muscles doesn't work. So if they're over age 8, we have to do the bony surgery.
Okay.
At this point, I'm looking at the shape of his socket, and I think he still has the potential to continue to recover that if we lengthen him again. So I think we should.
Okay.
He'd come in overnight, he'd go home the next day.
Okay. So he got to get cut again. He has to get cut again.
X-ray back up. We go through the same incision we used last time. So it's the same operation. A little faster because we don't have to do the nerve. The nerve already done.
Oh, I see.
So if you remember our discussion last time, we draw a line straight across the pelvis.
Right.
And then we draw a line straight down at the corner of the socket. So this whole ball right here should be sitting inside that line. So anything outside this line is abnormal. So this much of his hip, about 50% on that side. And it changed a lot since the last x-ray. So he probably went through a pretty big growth spurt in the past year, if I had to guess.
Yeah, because
He's
he's got
probably,
some
and he looks a lot longer, and his legs look a lot longer.
Okay.
And that's how they grow at this age. So right now his legs are growing very fast. His spine isn't growing very fast. When he hits middle school age, that's when they sort of reverse it. And then the spine starts to grow faster than the legs.
Okay.
But I think this is really a function of him just going through some big growth spurts over the past year.
Okay. So when will we do the surgery?
As soon as you can get it scheduled.
And when it's convenient, but it's not an emergency.
Okay.
Yeah.
So
We're
So
having a
over
big,
the next month or so.
the next month. Okay, because in March we're having a really big event.
okay.
It's called, it's for special needs. It's
Yeah.
something I put together. It's called,
Oh, that's great.
Paint the City Green, because cerebral palsy is March
Yeah.
CP Awareness Month. So I'm doing I'm trying to get the news there. It's going to be at a really nice gym. Someone sponsored me their gym. It's really, really nice. Some lady sponsored me their gym. And
Oh my
I was supposed to have the flyers today.
I was going to say, down
Yeah,
I'm gonna
maybe
bring
give
them.
us flyers.
Even if I don't have an appointment, I'm going to still
just
ride
mail
over here.
them to us.
Oh, yeah, I can
I'll
do
just
it.
Yeah, I'll give you my
Through the
card. You
text.
can email them or you can mail them, and we'll put them
Okay.
out. Yeah, just let us know. Because that's in Philly.
Yeah, March
Okay.
25th. It's on a
Okay.
Saturday. It's in
Awesome.
Darby.
Oh yeah,
Yeah.
yeah.
Right, 15 minutes
If
away
he's
from
starting to lean a little bit, he's not developing a structural scoliosis, meaning when he's laying down, his spine is right now perfectly straight.
Okay.
So some of these kids start to develop what looks like a tendency to go to one side. Over time, they can develop a scoliosis, a curve in the spine that goes to that side, but he doesn't have that right now.
Okay.
So we'll keep an eye on it, but nothing to worry about.
Okay.
But that is sort of the next big hurdle when they hit about 13 to 15, around that age. And that spine starts to grow really fast all of a sudden. Like right now, his legs are growing really fast. And then when that reverses and the spine starts to grow really fast, that's when sometimes those curves actually become pretty significant. So we'll cross that bridge if we ever get to it.
So the other concern Mom had was about his upper extremities. I
Where?
actually
Getting
thought
tight?
I think his tone might have increased, but his actual range of motion, I could get him to within 5 degrees of full extension. When I try to fully extend his wrist, he gets but with time, I could get him not straight, but straighter. So we were talking about like a full nighttime hand and wrist split. Right now, he's just got like a thumb abduction one.
Yeah, so that's Mom called a nighttime resting hand split. And what it would do is at nighttime, not during the day, just at night, holds his hand in this position.
Okay. But normally at night he doesn't sleep like this.
Yeah, but what it'll do is help stretch the muscles
Oh,
while he's
okay.
sleeping.
Oh, okay.
The reason you can't wear it during the day is because
It's hard, right? I think
well,
he
it's
had
in
to
the
go
way. It's like wearing a
And you
ping
can't touch
pong.
stuff.
It's like having a ping pong racket stuck to your hand. You know,
Okay.
it doesn't work. But at nighttime, we'll seize the advantage that he is loose and floppy because he's sleeping, and get those muscles nice and stretched out. So it'll hold his hand in this position at night while he's sleeping.
Okay.
All right. Those have to be made for him, so we'll give you a script for that.
Okay.
And if TheraPlay probably has an occupational therapist that can make them for you. So it's a one-time visit to an occupational therapist, and they'll make them.
Oh, okay.
Okay. And then again, I checked this side, same thing. We've talked. So his popliteal angles I thought were pretty tight. So I didn't know if you wanted to add hamstrings to that. And I got a small knee flexion and hip flexion contraction.
Yeah, 5 on the left.
5. Okay.
Maybe 10 on the right.
Okay.
Still pretty.
Okay. And now I've stretched him out for you.
Because if he was really tight, I'd say, well, he's asleep, we'll do his hamstrings, but I don't think we need to.
So what do you think about Botox again?
Botox is okay for loosening up tight muscles, but it never protects the hip,
Okay.
and that's been shown. So if you're trying to keep that ball from coming out of the socket by injecting that muscle, it never works.
Okay.
It's just not enough.
Okay. What about his hamstrings and his arms?
It'll loosen them up temporarily. It always wears off, right? He's tighter on the right side, isn't he? That's his tighter side.
His left.
About 55.
Mom actually thought that he was left.
At least today, on today's exam, it's his right side. Today.
It's super great.
Okay, so we're going to make him some splints for his hands. And do you have my office number?
No.
I'll give you my card.
Okay.
I'll put his case in the computer. So when you call my secretary to say I'm calling to schedule surgery for my son, she'll know exactly what we're scheduling him for.
Okay.
Really what you're doing is you're booking time in an operating room. It's like getting a hotel reservation.
Oh, okay.
And the surgery is fast. You remember last time. It's pretty quick.
What about this? You think?
Does he use it during the day?
He uses it just at school, but she wants to know. I think you sent it before. She wants to know how long should he have it for, and she also wants new braces because the braces he's outgrowing.
I'm happy to write for those. So solid AFO. So do we want to put him in that?
So that brace is to be worn just when he's sitting upright, just to help give him a little bit of prop, so that he's not hunched all over while he's sitting up in the classroom.
Okay.
And I can write that down. Do you want to?
Yes, I probably yes. I can send it to school.
These are pretty small.
So we're gonna move those.
They just
Do you
got
want to
those
put him
last
in that
month.
real quick just to make sure that it fits
Last
him
what?
okay?
I said last month. I meant to say last year.
I'll go get those scripts if you put him in that real quick.
Okay.
1 second. I'll get out of your way.
She said they're kind of tight.
Yeah, I think so.
She said.
The length's okay, but they're squeezing them a lot. We'll give you a script for a new set of these guys. I think she's right. And then let's get his spine brace on and make sure that's fitting.
Okay.
Head control is great. Doing great here. Doing great here. Do you lay him into it or do you?
Yep.
Just laying.
So braces like this don't treat or prevent scoliosis.
Oh, okay.
They're just meant to give him a little bit of prop so that he doesn't have to work so hard to sit up. And he can pay more attention to the classroom, what's going on, be more engaged.
What are you doing? You went to the bathroom.
Eat lunch? I should get myself one of these. That'd be easy. Looks like it. Yeah, that's good. That looks
Yeah,
great.
stuff looks good.
Yeah, perfect. And that just sort of helps give him a assistance. You can look around better. With those peepers. Those pretty peepers of yours. Let me get you my card.